Hello, I'm Donna Thorson, Senior Project Manager for Health Insight. This section is an introduction to a way of incorporating culture change and quality improvement efforts. The 4 E's were created by the Johns Hopkins Medicine Armstrong Institute for Patient Safety and Quality to address principles of safe design for improvement efforts and help providers achieve the lasting improvements they seek. The 4 E's can be used when recruiting a senior leader for the resident safety team or for engaging staff. The 4 E's help carry out patient safety interventions by focusing change efforts around technical and adaptive work. Technical work changes the procedural aspects of care that can be explicitly defined, such as prompted voiding, catheter care, and pressure reduction. Adaptive work changes the attitudes, values, beliefs, and behaviors of the people who deliver care. Adaptive work can be discouraging and difficult to target. You may be tempted to focus on technical work and ignore the adaptive work. Many change efforts fail because adaptive work is neglected. An evidence-based protocol, technical work, will only impact outcomes if staff understand, value, and prioritize use of the protocol, the adaptive work. This model features 4 key elements: engage, educate, execute, and evaluate. As part of the facility team, the senior leader actively employs the 4 E's and promotes it as a model for change. Engage is when you want the facility staff to understand the effects of preventable harm. Engagement is an example of adaptive work, and one way to engage is to share stories about residents affected by this problem and to estimate the number of residents who could be harmed as a result of this problem. Within the 4 E's model, you want to engage facility staff in understanding the effects of preventable harm. Engagement is an example of adaptive work, and one way to engage is to share stories about residents affected by this problem and to estimate the number of residents who could be harmed as a result of this problem. Education is an example of technical work in which the facility safety team communicates to staff and senior leaders about actions to prevent clinical problems. Execution is an example of adaptive work. It's based on the principles of safe system design. Simplify the system, create redundancy, and learn from mistakes. Evaluation is an example of technical work in which the facility safety teams collect and submit data related to any clinical problem to analyze the progress of an intervention. Leading facilities through change requires team members, including senior leaders, to use both technical and adaptive work to ensure the changes made throughout the project remain in effect even after the project ends. Consider how you can apply the 4 E's to speak with your senior leader or as part of your Quality Assurance Performance Improvement, QAPI, program. Here's an example of how the 4 E's could be used to address incontinence as a quality improvement project and improve your outcomes for the quality measure. When you engage, you're inspiring a shared vision. How does addressing incontinence make the world, our nursing home, a better place? Under education, we challenge the process. What do we need to know about managing and treating incontinence? Execution, when we enable others to act, asks us what do we need to do to improve our approach, and how can we do it with our resources and our culture? Evaluation encourages our heart. We look at how we know we've made an improvement in safety and in the lives of our residents. We've created this worksheet for you to use with your team. It is a way to investigate incontinence management and prevention in your facility from a quality assurance performance improvement, QAPI, perspective. This worksheet asks and has you answer the question, how does addressing incontinence make the world a better place? This is the opportunity for you to identify and describe the benefits for your residents and for the staff. Share personal stories of how someone has been impacted. For example, a resident who has been isolating because of incontinence issues. Or maybe there's a resident who chooses to be incontinent because he or she doesn't want to leave an activity and as a result develops skin breakdown and pressure injuries. In the second question, what do we need to know? You want to look at facility data for incontinence, specifically the residents that are identified as low risk for incontinence, to see what is going on with them. Look at the literature to identify best practices and guidelines. What are your current assessment strategies for investigating somebody's risk for incontinence and the causes so that you can treat them? What are contributing factors to someone's incontinence? And then how do we individualize the care plans to intervene, help somebody to maintain their continence and dignity? The execution portion of it is on the back of the document, and we'll cover that in one moment. Question 4 is, how do we know we improved safety? And this is the opportunity to actually identify outcomes that you will measure as well as processes that you will measure. And you can even look at anecdotal stories of residents and staff's lives being improved. Number 3, this table, what do we need to do, is adapted from Medline University's Developing a Successful Continence Program with a Systems Approach. It covers the evidence-based practices that are necessary and effective in managing and treating incontinence. What you're asked to do is look at what are your current resources that you can use in your building to actually provide those interventions, and maybe consider what resources you could easily adapt and bring into your building that could help promote these activities. And remember that we have to incorporate the adaptive portion of it as well, which is looking at attitudes, beliefs, and behaviors. So looking at your current culture, how would you be able to incorporate these practices? This also gives you the opportunity to explore where you might need to actually improve and educate people to modify their behaviors as well as address changing attitudes and beliefs. For example, many times people believe that incontinence is a normal part of aging, and we know from the literature and studies that it is not. So that would be a big place to start with staff, is making sure everybody understands that incontinence is not a normal part of aging. Once you've completed this worksheet, you can actually use this to identify the areas that you could do a performance improvement project around. So for example, it could be around the consistent assessment for incontinence on admission, readmission, or with significant change in condition. It could be about trying to improve a prompted voiding practice that you have in your building already. Take the opportunity to investigate both the technical and adaptive aspects of improvement so that you can optimize your chances for achieving and sustaining improvement. Thank you.